Madam President, over in the House today, the Ways and Means Committee is marking up Speaker Pelosi's prescription drug bill, the latest installment in Democrats' campaign for government-run health care. Like Democrats' other plan for a government takeover of health care, the so-called Medicare for All bill, the Pelosi drug bill will ultimately leave Americans worse off when it comes to access to care. Madam President, there's no question that the American health care system isn't perfect. High drug costs are a problem, and 1 in 4 seniors reports difficulty affording medications. Stories of patients being forced to ration pills or abandon their prescriptions at the pharmacy counter are unacceptable. But spending the entire American health care, or I should say, but upending the entire American health care system is not the answer. A strong majority of Americans are happy with their health insurance coverage and the quality of the health care that they receive. And Americans have access to treatments that individuals in other countries simply don't have access to. Take cancer drugs, for example. Between 2011 and 2018, 82 new cancer drugs became available. U.S. patients have access to 96% of those new drugs. In Germany, by contrast, patients have access to just 73% of those new cancer drugs. In France, just 66%. And in Japan, patients only have access to 54% of these new cancer drugs. In other words, Japanese patients are missing out on access to roughly half of the new cancer drugs that emerged between 2011 and 2018. So why do Americans have such tremendous access to new drugs while other countries trail behind? Because the U.S. government doesn't dictate drug prices or drug coverage. That's also the reason why American companies lead the world in medical innovation. Back in 1986, investment in drug research by European drug companies exceeded U.S. investment by approximately 24%. But all that changed, Madam President, when European governments stepped in and started imposing price controls. Today, European investment in drug research and development is almost 40% lower than U.S. investment. 24% higher in 1986, today 40% lower. Speaker Pelosi's bill would start the process of destroying the system that has produced so much access and innovation for American patients. Her legislation would impose government price controls on as many as 250 medications. If the progressives in her caucus had their way, the bill would impose government price controls on all medications. Either way, the result is likely to look much the same as we've seen before. Reduced access to life-saving treatments and substantially reduced investment for the prescription drug breakthroughs of the future. Under the Pelosi bill, Americans could look forward to a future where we might be the ones losing out on a quarter or more of the new cancer drugs that are coming to market. Madam President, there's no question that we need to find solutions to drive down drug costs. But the answer to the problem of high drug costs is not to destroy the system that has given American patients access to so many new cures and treatments. Republicans want to develop bipartisan legislation focused on lowering prescription drug costs without destroying the American system of access and innovation. The Senate Finance Committee, the Senate Health, Education, Labor, and Pensions Committee, and the Senate Judiciary Committee have spent a lot of time this year working on this issue, and work on truly bipartisan solutions remains ongoing. Earlier this year, House committees advanced drug pricing legislation on a bipartisan basis. But unfortunately, House Democrats have made it clear that they're more interested in playing politics than in cooperating on legislation to address the challenges that are facing American families. Democrats know that the Pelosi drug bill has no chance of passing the Senate, but they've chosen to pursue this socialist fantasy instead of working with Republicans to develop a bipartisan prescription drug bill that isn't just price controls and that might actually go somewhere. Like the Democrats' larger socialist fantasy, Medicare for All, the Pelosi drug bill would ultimately hurt the very people that it's supposed to help, in this case by restricting their access to life-saving drugs and future prescription drug innovations. Madam President, the Pelosi drug bill is a bad prescription for the American people. Madam President, I yield the floor.